Good morning, everyone. I am excited to welcome you to today's event, Teaching for Impact, How to Bring Health and Policy into the Classroom and Academic Settings. We are thrilled to have you with us and grateful to be partnering with SOPHIA, the Community of Health and Health Policies practitioners, as well as our outstanding speakers. My name is Tatiana Lin, and I serve as the Director of Business Strategy and Innovation at the Kansas Health Institute. I have also had the privilege of leading our health and health policies work for over a decade, and I'm honored to serve as your MC for today's event and moderate one of the panels. So let's take a quick look at today's agenda. We will start with a brief welcome and framing our today's event. Then we'll move into 3 panels and really highlighting a different strategy to bring health and health policies and health impact assessments into academic settings. First, you will hear about first panel will focus on the standalone health and health policies courses and health impact assessment courses. The second panel, you will learn about how to embed health and health policies concepts into existing academic programs. And third, you will hear about other creative approaches, including guest lectures and cross-institutional collaborations. We are super excited about the lineup and grateful to our speakers and partners from SOPHIA to make this conversation possible. And also thank you to all of you who have submitted some questions in advance during the registration. We shared them with our speakers in advance to help shape their discussion. Before we dive in our today's content, I would like to turn it over to our President and CEO, Carrie Braffett, to welcome you on behalf of the Kansas Health Institute. Since 2022, Carrie has led KHI with a clear focus on improving the health of Kansas. She brings decades of experience in health policy, including leadership roles in the state government and national organizations. Carrie, welcome.
Thank you, Tatiana. And I want to echo what Tatiana said. We're so excited and for this conversation today and want to welcome you to what I think will be a really engaging and thoughtful virtual forum. Whether you're a longtime advocate for health and all policies, or maybe it's something you're just starting to explore, I think there's going to be something for you in today's forum. As Tatiana said, a big thank you to SOPHIA, the Community of Health and All Policies Professionals, for partnering with us for this event. SOPHIA is a longtime leader in bringing together professionals and practitioners who are committed to advancing health and all policies and advancing health through thoughtful policies. We're really honored to collaborate with you at SOPHIA. We also want to thank all the speakers, as Tatiana said. Thank you for lending your time and your expertise. We want to learn from your insights, and for all of you, Tatiana pointed out, there's Q&A and comment. We can all learn from each other. So everybody attending today, we look forward to learning from you as well. For those of you who may be unfamiliar with the Kansas Health Institute, or we call ourselves KHI, we're a nonprofit, nonpartisan educational institution. We're based in Topeka, Kansas. We're focused on informing policy decisions through research, education, and engagement. We focus on health, and the focus and our work in health and all policies goes back to at least 2010, probably before that too, but kind of officially in 2010. Since then, we've conducted health impact assessments. I think there's going to be a link in the chat to some of the materials, our hub for our Health and All Policies Technical Assistance Hub that includes links to some of those health impact assessments. And we also provided health and all policies trainings over the years, not just in Kansas, but across the country. Through our work with the Pathways to a Healthy Kansas initiative, which is funded by the Blue Cross and Blue Shield of Kansas, we've also supported communities across the state in moving health and all policy strategies and ideas into action. We also really believe in the power of education. That's why we work with partners to embed health and all policies in academic settings. So we're going to hear a lot about that today, whether that's from guest lectures to curriculum development. A special thanks to Vicki Colley-Akers and our colleagues at the University of Kansas Medical Center for your ongoing partnership in this work. And finally, we've also been listening. In response to feedback from practitioners and community leaders, we developed a few years ago the HiC tool, the Health Impact Checklist, designed to rapidly inform decision-making in practical and an accessible way. And we're really excited to dig into all of this and more with you today. Thank you again for being here. And with that, back to Tatiana.
Thank you, Carrie, for such a warm welcome and for continued leadership for advancing the mission of the Kansas Health Institute. And now, with the great pleasure, I'm excited to welcome Dr. Sandra Whitehead. She's Assistant Professor of Sustainable Urban Planning at George Washington University and the current President of SOPHIA. Her work over the years has focused on health impact of the built environment. She brings a lot of expertise in the health impact assessment, cumulative impact assessment, and using health and policies to drive organizational change. I had the privilege of working with Dr. Sandra Whitehead under her leadership at the SOPHIA and have really seen firsthand all the incredible work she has done to grow and strengthen the organization. Welcome, Sandra.
Thank you, Tatiana, and thank you so much to KHI for partnering with SOPHIA on this great webinar where we're bringing together not just SOPHIA members, which I think all of our speakers are, but these are leaders in academic settings and in training the next generation of HiAP and HIA practitioners. So SOPHIA is really thrilled to partner with you today on this webinar, and I'm excited to talk about my program at George Washington University. But for those of you who aren't familiar with SOPHIA, we are an organization who started in 2011 as the Society of Practitioners of Health Impact Assessment. And as the practice of health impact assessment grew and health and all policies became more of our umbrella term that we're using, and HIA falls underneath that, we have adopted the moniker of SOPHIA by itself. And we do a lot of these kinds of webinars. We have another webinar coming up in August 21st on using some built environment tools that Tennessee uses. John Vick from the Department of Health is going to be our speaker. So we hope that if you enjoy this webinar and you're interested in developing your practice around HIA and health and all policies, that you'll become a member of SOPHIA and you'll have access to many more trainings and workshops and opportunities to participate in SOPHIA in developing these resources. So please go to our website and join if you enjoy this webinar. And I'm going to turn it back to Tatiana for our wonderful content today.
Thank you, Sandra, and thank you for featuring the opportunities to join SOPHIA. It's a great group, great thought partners, and great resources. And thank you, Sandra, for your leadership and for everything you have done to advance health and health policies across the country. So now it's my true privilege to introduce Dr. Keshia Pollack Porter, the 12th Dean of the Johns Hopkins Bloomberg School of Public Health. I had an honor following Dr. Pollack Porter's health and health policies work for decades. She has been incredibly visionary, advancing health and health policies in the ways that continue to inspire the field. Dr. Porter is an internationally recognized scholar and trusted public health leader. Her research focuses on safe and healthy environments and addressing the structural determinants of health through cross-sectoral collaboration. Dr. Pollack also authored over 200 publications and is a co-author of Policy Engagement, which was published in M.P.H Press. And this is really a practical guide for public health professionals involved in the policy process. And since 2019, she has directed the Robert Wood Johnson Foundation's Health Policy Research Scholars Program, helping train the next generation of health equity leaders. Thank you so much for being with us, and we look forward to hearing from you.
Hi, good morning, everyone. Thank you so much, Tatiana, for your warm welcome. And I want to thank you and Carrie and the team at KHI and Sandra and everyone at SOPHIA for making space for this really important conversation. As Tatiana said, I'm Keshia Pollack Porter. I see some familiar names here, and some of you may remember me as Keshia Pollack. I got married several years ago and have two last names now. So I'm just so thrilled to be here with all of you. And I'm honored to provide a few opening comments for today's conversation. In reflecting on this important conversation, I thought about when I was first exposed to health impact assessment, and it's actually nearly 20 years ago. And it was at a breakfast roundtable actually hosted by Brian Cole, who some of you may remember as a leader in the field, at an active living research conference meeting. And I believe that Andy Dannenberg, one of our speakers, was there, and Candace Rutt as well. And I remember that session focusing on how health impact assessments could be applied to projects and programs. And at the time, I was a new assistant professor in a Department of Health Policy and Management, and had been working with our state legislature on how to advance evidence-informed policies. And I saw something in HIA that I thought could be a tool to help to advance evidence-informed policymaking. And I remember that conversation and Brian saying at the time, which was around 2007 or so, 2006, saying that it was difficult to, there hadn't been a lot of HIAs applied to policy at the time. And then I really felt motivated and inspired to think about how HIA could help to improve policymaking. And a few years after that, I thought it was important for more public health people to hear about HIAs. And I called my colleague Aaron Warnham at the time, who was director of the Health Impact Project. And we actually did a training on HIA at Johns Hopkins, and then later developed a course, which actually launched in 2011. So I've been teaching health impact assessment at the Johns Hopkins Bloomberg School of Public Health since 2011, and excited to just reflect a bit on that course, which has gained in popularity since that time. And once I moved the course online in 2020, I've had consistently over 100 people enrolled every year. And it's been mostly public health students. You'll hear today from other courses that bring in students from other divisions or departments. And I'm excited that we've, over the years, have had students take the course who are from nursing and from engineering and arts and sciences. But by and large, it's a lot of public health students. And as I reflect on that course and that experience, I want to share 3 points that I think are important for today's conversation. One is the importance of working with a partner during the course to promote the practical applications. And I know we'll hear about that today in this webinar. And I acknowledge that sometimes it adds a layer of complexity, but it's incredibly important for the students to get that opportunity to wrestle a bit with, in terms of working through an issue in real time with a partner, engaging with partners. And unfortunately, I'm hearing from students who are not exposed to that as much as they would like. And I think that element of the course, when possible, is critically important. The second point I want to emphasize, and again, I believe this will be covered today as well, which is around how do we bring and amplify and elevate HIA into curriculum? So it might not be possible to create a new course, but when we can, how can we give lectures on HIAs and bring it into certain courses? So for example, I recently gave a lecture on health impact assessment as a policy analysis tool in an intro to public health policy course. So certainly doing that helps to get people excited, and they later might take my course. But to the extent that it's not always possible to create a new class, how can we actually integrate the content into other aspects of the curriculum? And finally, when I think about the importance of health impact assessment and how I've heard from students many years later who have taken the course, they talk about the value of the content for helping to remind people and emphasize the ways to promote and think about health in all policies to advance health equity. So if we think about a goal of health for everyone everywhere, healthy people being able to, or communities thriving, people being able to thrive, when I think about the specific tools and skills in the class, we know that a course on health impact assessment helps to highlight the ways that programs, policies, and practices outside of health can impact health. We know that the course really helps to understand how do you get to the root causes and drivers of health and health inequities. Provides an opportunity for trainees to authentically engage with community and stakeholders, and to really think about how can we help community bolster their power in making decisions that impact health. I also have seen many students who actually learn about how to approach community with humility and partner and listen to them as we're thinking about bringing their voices into the stakeholder engagement process. I've also heard from students who talk about even learning the value of working together. I know many of these courses have group projects or team projects. And I think that value of learning how to work together to solve a problem, to move forward on addressing a goal, has also been critically important. And I was able, in preparing for today, pull back some emails that I've gotten from students over the last decade that really lift up these skills and these points that they've received through the health impact assessment course. And so I'm thrilled to see Katie Hirono, who's one of the speakers today, who co-taught this HIA course with me this past year and who's taking over as lead instructor moving forward. And so, again, I just want to say how thankful I am to be here today. I'm so excited for this conversation. And I want to just applaud everybody who is leaning in to help prepare our current and future public health workforce, to help people think about the importance of what's happening outside of the health sector to inform health and to impact health equity. And thank you to everybody for making time to be here. Again, thank you to KHI and to SOPHIA for making space for this important conversation. And thank you, Tatiana, for letting me say a few words.
Thank you so much for being with us and for really inspiring keynote and setting the stage and really focusing on that practical application and the importance of that bringing them in those courses as we continue this discussion. I know we have a couple minutes. Are you open to take a couple questions if you have any questions from the audience?
Of course. Yes. Thank you.
Thank you. Please feel free to add your questions to the chat of the Q&A. So as you're thinking about the questions, one question that I do have, if I may ask you about that practical application, what have you seen worked well? How can faculty bring those practical applications into the classroom when they integrate health and health policies?
It's such a critical question. And I think for us, it's really been communicating clearly with partners about what health impact assessment in particular, or other tools that people might be using could actually help achieve, and actually what it doesn't achieve, right? So I have had community partners will reach out and say, hey, I think that I might need an HIA for this issue. And having that, we have a conversation up front about what the tool can help to yield. And many of them talk about, well, we actually just need the data to support advocacy on a problem, which is critically important. And so it's part of my job is to help them understand that this might not be the best tool, but how can we actually help to support that goal? Or if we were going to do this analysis, what are the things that it could elevate? So I do think being really clear on expectations and what's important for people to know could come out of working together, I think is critical. So really being clear on expectations, I think, is number one. And every year I've had a partner in the class from different sectors. That has been the thing that has been really, really important. The other thing, as I'll say, is the courses at Hopkins are 8 weeks long. So as you can imagine, teaching HIA, doing the practical application, and having something to show for it at the end of 8 weeks is a lot. And so thinking through, again, what are the expectations and what can we provide, and providing opportunities for students to actually engage further once the class is over. We've had several students who've gone on to work with the community partner after the class is done to continue to dig into the analysis. So first and foremost, expectations, and then finding the partners and engaging with them from a place of humility, I think, is also critically important.
Sharing those insights. And we have a couple more questions. So one is, what are the barriers to bringing health and health policies to the classroom that you have found most difficult to address?
Yeah, I would say one thing that continues to surprise me is people who say to me that they've never heard of some of these tools. Like, it's really fascinating. So just, I would say, some people coming in with a preconceived notion of what health and all policies is, or what health impact assessment is, particularly HIA. Like when I've talked about, I start my health impact assessment class going into health and all policies. But I've talked to people and people say, oh yeah, I know what that is. It's evaluating things after they're done, or it's an evaluation tool. And I think helping people understand what we're trying to do with health impact assessments, I think, continues to be something that's important. The other part is, and I'm sure this will come up today, is around some of the limitations we know about the estimation process, part of the process, right? And so I have people in the class who might be very quantitative, who say, well, I want to have very precise estimates, and how do we actually say what's going to happen? And so just talking through the methodology, I think, again, really challenging some preconceived notions, I think has been a challenge. But by and large, people are excited, and excited because they see the potential for this approach to policy making to really make a difference and to advance health equity. Those connections are so clear amongst our public health students, and also have been clear amongst people I've been able to interact with who are outside of public health.
Wonderful. Well, thank you so much for your time. I know we had a couple more questions in the chat, but we will have to move forward with our agenda, and we'll try to get to those questions during the panels. So Dr. Pollack Porter, really appreciate it again, and thank you so much for your comments. So now it's my pleasure to transition to our panel discussion, to our first panel discussion, featuring incredible visionaries and leaders in the health and policy spaces. Our first panel will be moderated by James Dills. He will explore experiences with the standalone health and policies and health impact assessment courses. Jimmy is a senior research associate at the Georgia Health Policy Center, where he advances health and policies through system thinking, health impact assessment, and healthy community design. In addition to being a trusted technical assistance provider, Jimmy actually brings an incredible sense of humor, if you know Jimmy and work with him, and really approachable to his work, and making this really complex concept of health and policies more accessible and collaboration more fun. So with that, it's my pleasure to welcome Jimmy and the panel.
Thank you very much, Tatiana, and echoing the thanks to Sophia and KHI and everybody for giving us some time today to talk about this interesting issue. So I'm excited to be part of a panel or moderating this first panel that is made up of 3 people I've worked with through the years, and I'm really excited to hear what they're working on. So we've got Dr. Andrew Dannenberg from University of Washington. We've got Katie Hirono from RPS Consulting and affiliated with Johns Hopkins, as well as what's your other affiliation? University of Wales somewhere. Then Lindsay Rio-Muto with the American Medical Association and also with University of Illinois, Chicago. And so without further ado, I want to start hearing from them, and we'll just go down the line, starting with Andy. What are the HiAP classes you've taught, and what are your biggest aha moments as you've been developing them?
Great. Well, thank you for the opportunity to talk about this. I've been teaching a health impact assessment class for about 15 years here at University of Washington. Previously worked on HIA when I was at CDC in Atlanta, and have worked with Keshia and others over the many years. The couple of key things in the course we've been teaching. One is it is cross-disciplinary, so I actively listed in urban planning as well as in public health. We get students from public health, urban planning, architecture, public policy, social work, and a range of other disciplines. And that really has contributed a lot to the class to be able to cross those disciplines. We actually listed as an objective of the course is to work in an interdisciplinary environment. The structure of the course, I try to do 2 things, even though one of them ends up kind of dominating. I want people to learn, the students to learn about HIA as a field, but I also want them to work on a very practical project. And what happens toward the end of the course is they are so focused on the practical project that they end up kind of, hearing, but not quite as much focusing on what the field of HIA is. So we get as Keshia mentioned, we get a local partner every year. That's one of the harder things in the course is finding a partner to work with. We've worked with the County Parks Department, with the City Department of Transportation, the City Department of Community Development, some other communities, planning departments. But each year we find a willing partner who is willing to both present at the beginning of the class, to host a field visit, to come hear the student recommendations at the end, and have some really good interactions with the students throughout the course. And when you ask students what they liked about the course, those community interactions are really very much a highlight of the course. The field visit, getting them out of the classroom to see what the actual project is that they're looking at. So that's a big highlight of it. The other components of the course, the part of the course to say what is HIA about, is one of the required exercises is to review an existing HIA. So we take it off of one of the databases of HIA or take one of the SOPHIA recommended good reports and have them critically review using criteria whether that how that HIA did. So they learn a lot about what an HIA should look like. We also have guest lectures that have a session on environmental impact assessment because it's highly related, and a session on health and all policies. Each of those sessions has a practical exercise during the class. So that way they're getting exposure to HIAP, to environmental impact assessment, and then a lot on health impact assessment itself. We also include a lot of readings, both optional and required, so that we feel by the end of the course, and it's only a 10-week course, Keshia mentioned hers was only 8 weeks, it's a tight amount of time, 2 hours a week with a lot of outside work, but the students do get a good exposure to what the field is. We do include health equity being a very important part of HIA, so that gets emphasized through the course. We do include some undergraduates, so it's a graduate level course, but we open it to junior and senior undergraduates. What I have found with the undergraduates is if they're willing to take a graduate course, they're generally willing to work pretty hard. So actually some of the undergraduates have been some of the stronger students in the course. We do have a link that I'll put in the chat when I'm done that lists the actual products of the class over the last 15 years, because each year we do a final report and presentation to the collaborator, and then we take their input and then send the actual final report to them after we've incorporated their input. We now have a website within our environmental health department that lists those reports. So I'll put that in the chat, and so those who want to look at what we've done can see that. So I think that's the main issues. The big thing, that community collaborator and field visit are real highlights of the course.
Great. Thanks, Andy. And Katie, same question to you. What's been your aha experience? What have you taught beyond the Hopkins course that Keshia mentioned? Give us your quick overview of what you've taught and how and why.
Thanks, Jimmy. Yeah, so I've actually had the real privilege of being able to teach health impact assessment and health and health policies in 3 different continents. So I I still contribute to the HIA course that's taught at the University of New South Wales, Jimmy, which is in Australia, not in Wales, the UK. And that course is taught as a 3-day summer school intensive. Obviously, when I was living there and working there, I was teaching that course in person. Now, as an affiliate with the university, I'm contributing as a guest lecturer, sort of online. I then helped to co-convene the HIA course that was run in partnership with Margaret Douglas at the University of Edinburgh. That one also was intended to be in person. And then I'm sure, as you all know, we had COVID and a lot of those courses got moved to online. But that was a great experience getting to work in both formats for that course. And then as Dr. Pollack Porter mentioned, I've now had the opportunity to come and teach fully online at the Johns Hopkins course. But we'll actually be given the opportunity to teach in person for the Hopkins Fall Institute in Barcelona this year. So it's been really interesting because I think obviously there's a lot of similarities in the content that goes into the courses. Some of the approaches to how the course is taught, whether it's online, in person, affects kind of what you can do in terms of having a real world HIA, having real world partners. I've had scenarios that worked really well, where we've actually had students go through an existing HIA, but sort of take out key bits of information so that they get the context of what the HIA was about, that they themselves have to do the scoping, or they themselves have to do some level of literature review or create recommendations. And then they can go back and see how that compares to what the HIA that we were using it on, what they actually did. But what I would say in terms of one of my big aha moments when I started teaching these courses is that students do come in with really different levels of understanding around policy formation. And so, like as Dr. Pollack Porter mentioned, I've absolutely seen where students kind of get stuck on this idea that HIA is an evaluation strategy, or that it should somehow be something that you can use, you should be able to have really rigorous quantitative data that goes into it, and years and years to collect baseline data for robust HIA practice, without really understanding how HIA is a very adaptable tool that can be used in varying policy contexts. And so that, I think, has become a stronger part of my teaching over the years, is really teaching students about policy formation so that they understand not just, a lot of them are coming in with public health backgrounds, so they get the health side of it, they get the social determinants of health side, but spending more time emphasizing how policies are made, how policies in other sectors have an impact on health affects those other sectors. Really spending time with them to kind of understand that better, I think, has been an important part of my learning process in teaching HIA.
Definitely. Thank you. I saw your face light up when Keshia was talking about the precision of estimates and quantitative, and that is a mindset a lot of folks have. And HIA, HiAP in general, is really about the practicality of getting that into policy decisions. So I really appreciate that that point you're bringing from across the globe. And apologies for stumbling over your affiliations, as many and as important as they are. And I'll hand to Lindsay. What's your take? What have you taught? What has been your aha moments as you've done that?
Yeah, thank you. And it's hard to follow these two, so I'll try to say things that sound new and unique. But before I start, I just want to say, as an AMA employee, these are all my opinions expressed today are mine alone and not of the AMA. So I just need to say that before I start. My experience teaching AA was really brought about as I was a PhD student. So when I started as a PhD student at the University of Illinois in Chicago, or UIC, they had also just started a joint degree program in urban planning and public health. And I was coming in as a public health person into the planning world. And I was like, wow, this is so amazing. What sort of courses are you all offering that bring these two fields together? And the answer was nothing. It's just essentially doing two separate degrees at the same time. And at first I was offered to do a guest lecture in a planning studio class. And when I did it, the first year I did it, there was so much interest with the planning students around HIA. And there just seemed to be a lot of excitement. So the second year that I got asked to do that same guest lecture, I sort of did an informal poll at the end and was like, who would be interested in a full class on this? And there seemed to be enough interest. And I had sort of the blessings of the faculty in the planning department. So as opposed to what Dr. Dannenberg said, most of my experience, I taught the NHA class over 2 years, were mostly planning students, but that was really meant to target those who were both enrolled in the dual degree program, or just those who seemed really interested in that. And we have 15, I can't remember if it's 15 or 16-week semesters, but they're longer. So I think in some ways, the time constraints are still very real in terms of doing a real world HIA project, but with a little bit more cushion. So I would say, again, echoing some of the things that others have said, my big aha moment wasn't just how important the real world HIA projects are for the students, but really setting the groundwork for that prior to the course. So 2 to 3 months before I started teaching, and maybe some of this was like the nerves of teaching an HIA course by myself for the first time, I was reaching out to different organizations and trying to make those connections. Explaining what HIA is, just like Dr. Pollack Porter mentioned, like how important that is to set up those expectations. But finding some really interested organizations to work with who found a lot of value in that process, just as the students found a lot of value. And even one of the students who took the first class I taught, he ended up doing an HIA for his final master's thesis, kind of building off of the work that we did. So it made me very proud to see that was, he took those skills and he expanded his portfolio essentially with those skills, which was really exciting. And then I think after the first semester, the other big lesson I learned was how important it was, because there are so many components of an HIA, that you really have to be, I don't want to say holding people's hands, but really making sure you're like checking in with students throughout the semester on these various components. So instead of just saying, oh, this big project is due at the end, really using time in the semester to break down each of these components of the HIA along the way, to say, let's check in. How are you doing on this? Because if you're not able to successfully move past some of those initial stages, it's really hard to get to the end. So to me, those were some of the big lessons learned when I was teaching.
Great, thanks. So kind of coming to it from a different standpoint of right place, right time, 2 degrees, bring them together and start engaging with the students around that. And I really appreciate, and I think this feeds, Andy, to the next question for you about the importance of those practical applications, those case studies, and the responsibility to build the relationships and have, a lot of that happens before the class. And so, Andy, the question to you is, have you decided like which case studies, particularly maybe which frameworks you actually bring into the class? There's so much out there. How do you fit it into your, I think you said 10-week class? How do you choose?
Yeah, I have a set of criteria of what makes a good case study for the class. It includes finding a local partner because we want a place we can visit the site. It includes the timing of the project, which means not too early and not too late. Too early means there's too little information available, so the students have nothing to examine. It can't be too late, meaning the decisions are already made. The students want to feel that, the advice they give at least will be considered. And then it's finding a partner who enjoys students. And we've had some feedback from some of our partners that, hey, this was great. They hadn't really been around universities and schools all that much. They're working for the county agency or whatever, and the chance to interact with students so that they've really enjoyed that. So it's really the right project is right timing and good partners who are willing to work with us, and ideally a place that we can visit.
Interesting. And real quick, if you can, I recognize the value and picturing out there in Seattle and the local ecosystem of work, and that's where you can go and where you can do things. Have you ever had the chance to do one at maybe a state level policy? Has that ever presented itself, or is that just too complex?
We have not done state level. We have talked to people at the state who have done some state level ones. Policies are a little harder to visit, and so that I think that one of the highlights of the course is that field visit to a physical site. But we have done some local sub-area plans, but a sub-area plan is kind of a policy, but it's about a physical place, so we've been able to visit those places. But yeah, we have not tried at state level, in part because it's harder to visit.
Yeah, it's a real tangible nature. And then Lindsay, for you, as you think about mixing these real world experiences into a curriculum, what has been sort of from your experience, what works best in terms of the mix of practical application, classroom learning, et cetera? What's the right mix from your standpoint?
Well, I just wanted to go back briefly because one of the HIAs our students worked on was tied to a state policy, because we were working with a legal aid organization that was really interested in changing a state policy around criminal justice. And so it was harder. I will tell you that. It actually, I feel like what we ended up doing was a lot of background research and like how this could be really health promoting, but it didn't align super well with the Illinois state lawmaking cycle. So yeah, those are challenges. So much like Dr. Dannenberg said, and maybe because I used his syllabus as like a framework for the way I ended up structuring my class, we had 3-hour classes. So those are really fun to fill 3 hours with every week. So I made sure as much as possible to have, some amount of lecture. I brought in a lot of guest lectures, and maybe this was like the post-COVID world, but realizing that you could bring in all these people via Zoom from across the US was really quite timely for me, because I was really able to draw on this amazing network of a lot of SOPHIA practitioners to speak to class. And then I almost always left at least 45 minutes at the end of class, because we had the group projects for them to be working on that hands-on and to use that class time effectively, and ideally to use time with me if they had questions and needed feedback on what they were doing. So I was very mindful, especially towards the second half of the semester, to build in that amount of kind of break. The first half of the semester, I was really focused on sort of teaching the fundamentals of HIA to set them up for the big project. So that it was, more lecture heavy at the beginning, and then really focused on mixing things up a lot more. And I tried, especially because I had more planners in my class, I really tried to bring in a lot more case studies and examples of HIAs that were very relevant to that field. I hope that answers the question.
Great. Well, I think what I'm picking up on as an HIA practitioner is that the course development is pretty analogous to an actual HIA in terms of the relationships, picking the right target to go after, being able to adapt based on the conditions and the time frame for the course, the time frame for each individual session, and that will inform the robustness of what you're able to do and adapt from. And I think that's a real key principle of cross-sector work, which Katie brings me to the next question for you, is teaching across multiple continents. How do you bring that into the classroom, the cross-sector nature? And you already alluded to it a little bit with the sort of practical nature of things, but talk a little bit about how you emphasize that cross-sector nature of HiAP and HIA.
Yeah, well, one of the things that I think has worked really well for a lot of these courses is that we have offered them often in partnership with like a local health department so that their staff can actually attend the course as like a continuing professional development opportunity as well. And so what that has often done is it's brought in like, everyday public health practitioners who are coming in with real world issues and projects that they're working on and policies that they're creating, to bring sort of that real, like, practical cross-sectoral experience into it. I mean, obviously most of those people are still health, but they are the ones who are out there engaging across, the health and all policies spectrum. And so I found that in and of itself has been really beneficial when the course can be offered that way. And I will say that that's sort of the benefit of having the Australian model, where it's offered as a summer course, like this 3-day intensive. It's sort of a bit more viable for like other public health professionals to attend that as like a 3-day intensive rather than trying to take a course over the semester. But then, yeah, and then I like, similar to Lindsay, I think bringing in sort of guest speakers and people from other sectors to bring that real world perspective just adds a lot of value, because these courses are within typically, schools of public health. That's where most of the students are. I just think, like I mentioned before, they just oftentimes are not exposed to, how policies are made or how laws are made or how decisions get made in other areas. So bringing in people who've either worked on an HIA or are working in other spaces to talk about how they're practically doing this work, I think is really adds value to the course.
Yeah, thanks for that. And I think that. Oh,
Can I give a shout out
Lindsay?
to Katie, because Katie actually connected me with people in Wales who then guest lectured in my class. So I just want to go on record and thank Katie for that.
Thank you. Well, that's happy to help
it's
anyone
amazing.
connect, globally to, if you were looking for a guest speaker.
Yeah, and just to shoehorn it in here, just, that's the value of SOPHIA as a global network of practitioners. I don't think it came up yet that Katie is a past president, Tatiana's a past president, Sandra's the current president. A lot of us have been on the board through the years. And that's the purpose of the network we're trying to build, is so that Lindsay can reach out to Katie and then get connected to somebody she never knew about from somewhere else. And Katie, back to sort of thinking about the cross-sector nature, and I think that it's sort of in the real world, how cross-sector collaboration happens, and then how do you train people for that in typically a graduate sort of public health setting. And then we got one question from the audience that I'm going to massage into a broader question that came from some of the registrants, is thinking about, so we've talked a little bit about the sort of the planning type of folks, the public health folks. What does it look like when you've had more health professionals in the course, like clinicians? Keshia, you mentioned having nurses in the course. When folks are closer to that downstream clinical space, how do you engage them in kind of upstream cross-sector work? And then thinking too on the other end of the spectrum of credentials, I guess. How do you, Andy, you talked a little bit about having some undergrads. Do you guys ever go down further and pull eager high school students and youth from the community involved? So how do you really think about, I think, start with that clinical perspective, as that's the sort of core health downstream perspective that we want to get involved. But then how are you also involving, people from nutrition curriculums or people from high schools or from the community in sort of the broad suite of how your courses intersect with the practical world? And we've got a couple minutes to answer this question.
Okay, quick answer on that. We have had some medical students and some nursing students in there, and they do great and they seem very interested. My sense is they're not real likely to use it. They're using it to expand their horizon rather than something they can take back and necessarily use. Other thing I want to mention is that we have some slides, happy to share them, of being able to do HIA exercises in class, 5, 10, 30 minutes, where you can just, to introduce the topic, can be as simple as an interactive exercise in class. And so that can be used at the at the high school or undergraduate level or whatever. Even if it's not a full course, there are ways to introduce the topic in a handful of slides and in-class exercises where, here's the scenario, here's a few questions, what do you think the health issues are, what might you do about them, all can be done in a fairly short thing that it does give some introduction to what the field is about.
And can I add to that also, one of the things that, because the courses I've taught typically haven't done like one HIA that all the students work on throughout the course. What we do instead is that for one of their assignments, they have to pick a topic and then do like a sort of rapid HIA of that topic. And what that does is it allows them to pick something that's relevant to where they are working. So if you have people who are clinicians coming in, they can pick a policy that's being put forward within their health system or within their hospital and do an HIA of that. And I think it really helps other students to learn that HIA can be applicable across a broad range of policy areas within health settings, outside of health settings, across all these different sort of topic areas. And then students feel that they get value out of it because they get something that they can then go back to their institution or where they work with some information about that.
Finding that win-win value. Lindsay, I want to give you a quick chance and then last comment.
Before I moved back to Chicago when I was in New York, NYU's medical school had some sort of elective for their medical students, and they asked me to come in and do a guest lecture on HIA for that. I'm not quite sure what ended up being the sort of end result of that class, because I think the class was more focused on like social determinants of health and HIA as a tool to assess that. But much like Andy said, I don't think the intent was really to use it. But I've also found this interacting with a lot of medical students within AMA is that medical students in my impression is that a lot of them are very focused on public health and really engaged in whether they call it the social determinants of health in sort of these other factors that they're seeing as, are impacting these downstream health outcomes. So I would say maybe I don't have as much experience with clinicians teaching, but within medical student community and population, I think there's actually a real big interest in HIA and more coursework around social determinants of health. So that's the only thing I would add.
Great. So I think it gets a lot to the language of cross-sector collaboration. What do we call it, and what does it look like as we integrate this across different fields, which I think is the handoff to Tatiana in the next panel that's going to talk about integrating HiAP and HIA across the curriculum, not just in a HiAP or a HIA course. So Tatiana, take it away.
Awesome. Well, thank you so much to Jimmy for moderating the panel and for fantastic conversation of the first panel to setting us off. So we are going to talk about how to embed health impact assessments or health now policies in other courses and academic programs. So it's a pleasure to introduce outstanding visionaries, Dr. Makros Chilaka. He's assistant professor of public health at the University of Brentford in the United Kingdom. He's actually leading the academic subgroup in SOPHIA. Also, it's a pleasure to welcome Dr. Florence Falk, Associate Professor in the Department of Epidemiology and Environmental Health at the University of Kentucky, and Dr. Sandra Whitehead, who is Director of Sustainable Urban Planning Program and Associate Professor at George Washington University. So without further ado, let's dive in. It's our exciting conversation. And so to kick us off, I would like to kind of start. Our first question is about integration in the broader academic courses. And Dr. Whitehead, can you start us off by sharing examples how you embedded health now policies or HIAs in the existing curriculum? And what are some benefits and challenges in doing this into already existing courses versus standalone?
Yeah, thanks, Tatiana. And to be clear, I work in a planning department, and I know that we've had folks who were primarily teaching in public health. And whenever I first came to GW, I was an adjunct professor, and I was teaching an HIA class as an adjunct professor. And 6 years ago, when I became the director, I looked at our curriculum and I said, we are really focused in on policy that centers the built environment and climate here at GW. And health is an inherent part of that. And so as we redid our strategic plan and went for our reaccreditation, we were very conscious about building health into every single one of our classes, from our theory and history of planning class, where we talk about the evolution of planning and public health together, all the way through our capstone evaluation criteria, which asks the question, how did you include public health criteria and considerations in your policy analysis for your capstone? So we have been very intentional about building health impact assessment exercises, those skills that lead to being able to implement HIA and HiAP throughout our curriculum, so that we are training urban planners to go out in the world and not just understand these tools, but to be able to work across sectors to implement these tools to make a better built environment and healthier communities.
So much. I really appreciate your point about strategically embedding health in every aspect of the course to make it sustainable. And now, kind of continue with that conversation. Dr. Chilaka, I would appreciate your approach. I know you're approaching it a little bit differently. Can you tell us about your experience of embedding that in the courses?
Thank you very much, and greetings from the United Kingdom to everyone who majorly are in the United States. I'm currently program leader for the Master of Public Health program at the University of Bradford. And before now, I've taught in a number of other institutions within environmental health, health services management. And to say that in all of these, I've always found opportunities to talk about health in all policies and health impact assessment. So in my current position, for example, there is a module within the Master of Public Health course that deals with social policy and leadership for public health. And so it gives me that opportunity to then talk about health policies, healthy public policies, and then where health impact assessment becomes very useful in getting that to do. And in another course on health needs assessment, where I'm also asked to contribute, it's always easy to then bring health impact assessment into health needs assessment and the joint strategic assessments that local authorities do. So it's always that opportunity to let health participants who always appreciate the value of health in all policies. And one of the major things that has always helped now, since it can be a full HIA course, and so we can talk about processes and details, but talk about application so people find the relevance of health in making their policies much healthier. Thank you.
So much. The realistic and the practical applications is so important, has been, seems to be a key theme across the panelists and our keynote today. And so now Dr. Falk, I would love to hear your perspective. How do you embed that in the courses or in the courses of other disciplines as well?
Okay, great. Thank you, Tatiana. I just a little bit about my background. I'm formerly with EPA's Office of Research and Development, and I retired in 2017. But before I left, I had the great pleasure to put together an effort in the EPA Sustainable and Healthy Communities Research Program to look at the applicability of HIA to community-based decisions, identify some best practices. We created a toolkit, and we conducted several HIAs with regional partners. So all of that together really made me see the value of HIA at that community level. And so then when I went into teaching, it really gave me that desire to continue to promote HIA as a health and all policies tool. So currently, I am teaching at the University of Kentucky in their Master's in Public Health program. And one of the courses I teach is in environmental health. So, in that class, we cover all the basics. We talk about toxicology, water, infectious diseases, food safety, the determinants of health. So we lay that foundation for environmental health. But then I have incorporated HIA as kind of this overarching assignment with many different parts to it across the semester. And what it does is it lets those students immediately apply what they learn about environmental health to a current issue using the HIA process. I have students coming from all different degree programs. Many of them, other people have mentioned civil engineering. I've had some MDs, people from toxicology, from chemistry, health promotions, health policy, and of course, epidemiology. So incorporating that HIA in the environmental health class really helps them see the connection between environmental health, decisions, policies, projects, and public health impact. So it really helps them see those connections. And the goal of having HIA as this overarching project is really to give the students some hands-on experience with a project that maybe they might encounter in their career as a public health professional. I am going to talk a little bit about the cons because we just don't have enough time to delve deeper into the whole HIA process and health and health policies more generally. We don't get to talk about best practices, some of the tools, the engagement of stakeholders, that monitoring and assessment. We really, I mean, I introduce it, but we really don't get to delve into that. So we just focus on scoping, assessment, recommendations. The students create a presentation, but they don't get that experience of writing a formal report. So the pros are they get to immediately apply some knowledge in a real world example, but the cons are it is limited relative to the whole HIA process.
Thank you, Dr. Pollack. I appreciate you highlighting some potential. I guess it's the game of balancing that to add value and figure out how to minimize those potential side effects of that. But building on that question and your answer, Dr. Whitehead, if you thinking about how during the integration, we want to make sure that this material complements the rest of the course curriculum. And so, and again, to what Dr. Falk also said, that worse, thinking about the potential limitations of when you do this embedding, not having enough time. So how do you ensure in the work that you do that there is really that aligns with the existing curriculum and really builds on the existing curriculum?
I think, especially building on what Flo was saying about the time and the comprehensiveness, right? Because we have the privilege and to be able to really sit down and say, well, how does this fit into each class? There's also this issue of completeness, right? Unless the students are able to take the elective HIA class, they're getting the pieces of health in the built environment and how to assess the built environment in terms of health, but they're not necessarily getting the tool, if that makes sense to you. They're not, as Flo said, they're not getting to write an HIA. They're getting to do some of the pieces. Primarily, if you're thinking about community engagement and urban planning, right, you have to do some of the pieces. You're still doing assessment. You're still doing describing the community and the demographics, but your limitations are that you're not getting the focus on health, right? You're still doing the urban planning pieces of it. And I'm hoping that the way this works out, because we do assess whether or not they're picking up the health skills, whether or not they're getting the competencies that are also associated with being a good planner, also associated with HIA. I'm hoping that the melding of those two things come together in our graduates. And as Flo said, they're able to pick these tools up and use them in whatever career they decide. Because we are an interdisciplinary program, it's sustainable urban planning, but we also have teachers from engineering, from public health, from across the spectrum. Really where it comes together is in that HIA class, but it's an elective. So we do have limitations and there are challenges, right? Like I have 2 instructors who are engineers and they're not really comfortable with, as you were talking about earlier, I think Andy was talking about the fuzziness of categorizing the impacts and predicting impacts. They're not very comfortable with that. And so it's kind of hard sometimes, right? To get them to teach it, not just to get the students to take it, but to get the instructor to buy in.
Well, I think that really builds well to the next question, thinking about that it's really talking here of interdisciplinary, so it's not just in public health. So Dr. Chulaka, how do you introduce health impact assessments, health and health policies to students who don't have a public health background? And actually, as a matter of fact, maybe to the faculty that don't have to, Dr. Whitehead point about that might not be teaching public health. So how do you introduce this to both to make it effective implementation?
Thank you. Again, I come to the place of application. So I have in the different roles and in different institutions where I have taught and in different workshops I've encountered quite a number of people who, of course, do not have a health background and may not fully understand, will not understand health impact assessment. So for me, I find an explanation of the wider determinants of health and explaining the causal pathways of how things that are totally unrelated to health, they don't have an explicit health stamp on them, but how they can go ahead to impact on the health of people. That's always very helpful. So for example, I did address annual management forum of the British Council in Sudan. And to say, by the way, I do a lot of international work in developing countries. And so to have to address leaders of different sectors of government, and the theme, interestingly, was health is wealth. So my role was to bring that link between health and wealth. So to then talk about how economic policies, social policies can impact on people's health, to talk about how poor housing stock can then mean that people can go to hospital and being treated for fungal infections, and they go back home to a poor housing condition. It means you'll expect them in the hospital again the next day. So, but if we're able to deal with good housing quality, we will be addressing that matter from the very, very, very upstream level. Or someone who goes to see a clinician with hypertension, but the problem is really an issue at work. And so they go to work, they get hypertensive and tensed up, then they go to hospital. And if we just deal with it on the basis of clinical symptoms, then they might be given diazepam, but they go back to work, the issue is there. It means that the real root cause is dealing with working conditions. So bringing all of these non-health issues and help them see a causal pathway towards health. It's always the way I've tried to explain that. And then, of course, because it's not a full health impact assessment module, the goal is to whet their appetites so they can seek more and understand where they have to collaborate with people doing health impact assessment, either as part of planning plus policy process or in every other way. But I find causal pathways linked to the wider determinants of health to be very helpful. Thank you.
Dr. Pollack, I appreciate you looking down the social determinants of health framework and how to make it very practical depending on which type of industry or individuals are coming from to make this relatable examples. So staying with this topic of examples, Dr. Pollack, would appreciate your perspective on maybe your favorite, you probably some examples, but what is your favorite assignment that you feel like really worked really well for integration into the curriculum, and what really resonated with students?
So as I mentioned before, there's kind of this overarching project, like their final deliverable is a presentation about a health impact assessment on a pending plan, policy, or action. But what I do is I let the students go find that project plan or pending legislation. I give them a lot of resources about where House bills you can find, Kentucky House bills, where you can find things about brownfields redevelopment or issues about zoning. So I give them a lot of resources, and each student goes out and picks one pending plan, policy, or action. They bring it back to the class and they make their pitch. And they say, this is why this should be the HIA. And then they discuss it as a group. They talk about the potential health determinants and health outcomes. And then they make a decision of which one they're going to choose. It's really a great exercise for the students to see the potential application of HIA across a whole array of sectors. Because as I mentioned, I might have a civil engineer and a toxicologist or a health promotions person. So they kind of zoom in on something related to what they're doing. I do require that environmental health has to be a part of that, which it is on almost every one. So some of the previous HIAs that we did this last year, we did a Kentucky House bill on eliminating single-use plastic bags and carry-out styrofoam containers. They did a great job with that. We did a redevelopment of a brownfield site in an EJ community in Louisville, Kentucky. And there was the development of a huge EV battery plant in Elizabethtown, Kentucky. And that particular one, those students actually got to go and present that to the local health department. And they were very happy to get it. And we're going to use some of the materials that they produce. So overall, they're really engaged in finding that project. And so they're really invested in it once they make the decision.
That's amazing. I think it's so exciting, I'm sure, for students to be able to dive in and look at what's up there and how to connect it to their studies and have a little bit of that, responsibility, but also decision making and bringing this up and being able to articulate why that makes sense. So thank you for sharing this valuable example with the audience. So now I want to uplift one question from the audience. And so thinking about, that artificial intelligence has been on people's mind and figuring out what's new technology and how it can be utilized for different purposes. So the question is, how would you recommend navigating that of thinking about health and health policies and HIP, teaching, is there a way to leverage generative AI in an ethical manner for this work? And this question is for anyone on the panel.
Great question.
I can take a stab at it first, I guess. We have been, GW as a whole has a policy about how to use AI ethically. And then I require new students to take this course. It's just like a 40-minute course on using generative AI, how to use it, how to cite it, how to understand its use and its not use. And in HIA, really, especially thinking about how you're going to use it in screening and scoping and really to get your background information. And it can also be useful for scenario planning. I mean, there's just a lot of different ways you can use it and you can employ it. But I think the most important thing is A, to use it ethically and to not let it take the place of community engagement or actually talking to the people who live in the community. And B, to make sure that you are citing it. And most importantly, that you are checking what it's giving you, because it's still hallucinating. Some of the tools are great, and so much of it is your skill in prompt writing and how you're telling it what to do, because it's garbage in and garbage out still. But I think it's more of giving students a grounding in what it is, how it can be used ethically, and how to check it as the person who's using it, right? How to make sure it's giving you things that are accurate and that are not, students aren't using it to go around the need to go to the community.
Right.
Dr. Parkett, I appreciate you lifting up some potential possibilities, but also what kind of human in a loop approach to the responses and making sure that we are balancing the potential of this technology with some potential limitations. Great. Well, I would like to hear from all of you very quickly, maybe from each one of you, some final thoughts on, if somebody's trying to think about, okay, that sounds great, I'm inspired about incorporating health and policies and HIA in the courses, or work with somebody to do it. What piece of advice would you like to give them to move forward?
Well, one piece of advice is like saying, what did I wish I knew before venturing into health impact assessment and health in all policies, that skills for negotiation, for influence, for collaboration, because health impact assessment and health in all policies it works best when people work across sectors, multidisciplinary, and again, in my work in lower medium income countries, when you talk about health impact assessment, for example, or health in all policy, the first thing people think is, oh, Ministry of Health or Health Department is coming to take our job. But that's not exactly what it is. But just strengthening partnership and collaboration, and let people know that the goal generally of health in all policy or HIA is supposed to be a win-win, accomplish whatever aims, the projects and plans were supposed to be, but making it healthier for everyone. So influencing, negotiation, and collaborating skills. Thank you.
I'll add to that and just say that the HIA community is a very supportive and friendly community. So if you're thinking about how to integrate into a course or you have questions, go to SOPHIA. Go to individuals that are here, that are already doing it. And I think everybody would be happy to share some resources with you. So yeah, that would be my biggest recommendation. Yeah. I think something for Sophia to think about, if you guys want to think about it, and the education group is, it would have been nice to have access to some examples of assignments that link across the HIA process. So I don't know if there's an opportunity maybe to create kind of a repository or some examples that people could access.
Oh, wonderful. Well, thank you so much for all your comments and your insights, practical advice to the practitioners, and that's who are interested in the topic. I appreciate your time, and we're now going to move to our last panel. If for our audience, please stay with us for another 20 minutes. We hope you will enjoy the last panel, provide additional insights of how to do guest lecture innovative approaches, and going to be facilitated by Jimmy.
Yeah, thanks, Tatiana, and want to welcome Anna Marie Fiera de Mello, also one of the organizers of this event. So I want to thank her for that. And she's coming to us from Urban Health Solutions, Urban Health Partnerships, and is an affiliated person with Johns Hopkins. So I think it's really interesting the trajectory we've been on so far, and we've talked, specifically in a HiAP or HIA class. We've talked about integrating it across broader curricula, and now we're going to get a little bit of the perspective from folks on kind of a little more outside of that in terms of being guest lecturers, and how are you bringing sort of more creative and community aligned approaches into that. And so going on my questions here, Tatiana, I'll start with you and just ask, how did you start guest lecturing? How did these opportunities come to you, and what were they?
Wonderful. Well, thank you for being with us. For us at Kansas Health Institute, I think we were really building up to that for over time. So when we started doing our HIA work, and I don't think it was specifically track we were thinking about, but as we were continued with technical assistance and helping communities to figure out what it really looks like in practice, it came to our intention that one way to make it sustainable is really start early, to really bring it to academic setting. And so we approached several universities to think about what's possible, what's manageable, and really thinking in what we heard back was having a lecture is something a good start. It can really expose the faculty to what the course could look like or what that session could look like. It can also have exposure from the students. You can have input on your curriculum. And so almost like a pilot in a way. And so we were very fortunate that Dr. Vicky Kohler-Akins from the University of Kansas from M.P.H course gave us an opportunity to come with a guest lecture in community health assessment intervention and advocacy class. It was a policy class. And so what also set us for that success was the fact that we already had kind of a curriculum developed because we were using that in our technical assistance and had a practical exercise as a part of their curriculum. So we were able to pick it up and really adapt it to our guest lecturing.
Thanks. And Anna Marie, I'm going to pivot to you and ask an even broader question of just other creative ways you've brought in HiAP or HIA capacity building in a variety of settings, and if it makes sense here to talk about the answer you have going in the Q&A, fit it in here if it makes sense.
Thanks so much, Jimmy, and thank you everyone for joining today. Please continue to send those questions in the chat. It helps us to be able to communicate during the panel and outside of these panel opportunities. And I've supported health and all policies and health impact assessment capacity building across different settings, academic, governmental, community-based, from guest lecturing in public health, nursing, architecture, and urban planning courses at universities. I've also have led metropolitan and transportation planning organizations, trainings, local trainings with local health councils, public health institutes, departments of health, and other grassroots, usually nonprofits that are focused on place-based initiatives. So since 2011, through Urban Health Solutions and its nonprofit affiliate, Urban Health Partnerships, we've been implementing a wide range of these trainings and have completed multiple HIAs in transportation, housing, climate change. So one of the creative approaches we've used, and something in public health we've always understood, and it's very much fundamental in the HIA and the health and all policies process, is ensuring that community is incorporated and that there's a feedback loop from the very beginning. And so we've used the community liaison framework, which is a flagship model developed by Urban Health Partnerships, to offer that clear structure and consistent and meaningful community engagement that's essential and often not as defined in our process. And it was instrumental in helping both the students and practitioners kind of build that trust and accountability and equity into their work. And so one of the questions asking earlier, how do we talk about equity or incorporate the health lens now in our current times? And we've used it more of just increasing access or ensuring some of those upstream aspects are connected to what individuals are looking to address. And so depending on who we're working with, and I've worked in HIAs as a consultant and also as a nonprofit and in academic settings, it's always the same approach though. It's just trying to align what it is that they do on a day-to-day and how health and all policies can assist them in assessing a current protocol, a current plan or proposed project or proposed policy, and what those impacts will be from a health lens. For educators, one of the most useful practices we've been grounding our work in, of course, as everyone has said today, some of the real projects with measurable impacts. But when we looked at focusing on housing quality, stability, and affordability, some of looking at specific tools and methodologies has been something that our teams have been most excited, or those that have been interested are incorporating in HIAs into larger agencies or as practitioners, and then sharing that work in academic settings in guest lectures, so in short periods of time. So when we talk about methodologies that may even include the displacement risk ratios or integrated health impact modeling for transportation, they've also been proven to especially be engaging for these students. And in practical applications or in academic and training environments, that scenario-based group exercises where they're pre-populated. So this allows folks, depending on their technical expertise, to participate in the process throughout. So I mentioned it in the Q&A section of how we do that for undergraduate students. And I think it's really important. Someone mentioned high school or youth-based. We've worked with youth-led groups in Healthy Little Havanas. It's a nonprofit in Little Havana in Miami, Florida. And that when they engaged in the HIA, we looked at, okay, how do we pre-populate some of these with options? So if they feel this is the direction it should go in, almost like a video game where you're choosing, okay, this is the next step that we should do. That was very helpful. It was a bit before AI was as popular. And so now that we're looking at in classrooms using AIs for epidemiology, for contact tracing or other simulation-based for nursing and public health students, we're looking at the same to incorporate it into the urban environmental epidemiology course that I'm developing as part of my Doctor of Public Health program or practicum at Johns Hopkins. And those are a couple of the creative and applicable ways that we've been using it. Jimmy.
Thank you. Tatiana, I saw you come off mute. You got something to add? Or you want your next question?
No, actually, I appreciated the comment that Anna Marie made about, creative way. One of, if you're talking about AI and technology, she made it like a comparison to the video games. There's actually opportunity of those technologies to leverage them, like create like escape rooms that will be more interactive for the students as the tool itself to engage in, kind of testing their knowledge or just choosing the right pathway. I just wanted to share that.
I think there's so much power that's going to come from these tools, and it's on us as the practitioners and the researchers to understand them and figure out how to use them ethically and appropriately. And Anna Marie, it's amazing to hear what you're working on and seeing that. I have not had a chance to read it in detail, but I want to keep it up so I can. And Tatiana, knowing what you've been doing with the AI work at KHI. So that's a key piece. And I feel like I'm trying to figure out how to circle this back to the question we have prepared, but I think it'll get at it, Tatiana. So I'm curious, when you do guest lecture, when you find yourself in these environments, what kind of questions are you getting from the students or the participants? What is your guest lecture prompt in them in terms of what do you actually hear in terms of questions?
Thanks, Jimmy. And I think one thing that we feel when we doing the guest lecturing, our questions probably come from the content that we do provide. And so the way that we structure the content is we, of course, provide the foundations of what health and policies is, how health impact assessment fit in there. But then we really want to ground that in a practical exercise. So we have case studies that we have developed. We have actually on different topics and different policies. Some of them are real case studies that we have worked with communities on, and we present them to the students, and then they work in a small group environment during the class to connect policy to health, to really understand what could be the health implications of that. And so as they go through that process, the question that we typically are hearing or getting about is, so how do we do that in practice? Like this is a great opportunity in the classroom setting, but how do I get engaged outside of the classroom? What are some opportunities to engage with elected officials and actually do it on the real policy? They're also trying to wrestle with the fact was like how, whenever we provide recommendations, how likely they get incorporated in the actual decision making. And so what weight do they carry, and how we want to make sure that decision makers are considering our insights and inputs. They also want to understand how to balance resources. So how do we actually do it in a way that is comprehensive, but also considers, resource limitation or time limitation. And specifically, if the students come from outside of, public health background, is really trying to understand how to tie to their specific field. One thing that we found helpful in the guest lecturing is doing a survey. So sometimes we do a pre-class survey to understand, their familiarity with the subject matter, what questions they do have, and that informs our curriculum development. And also at the end of the class as well, we're circling back and asking the feedback, and it also helps to change or update the curriculum. One other aspect that now that we are continue doing this work in Kansas, when you're working with universities, we are trying to explore that real connection to real decision-making process. And I think that's something we heard from other panelists is, can you just take it outside of the classroom? Can the coursework or example actually focus on real policy where there's a collaboration between, county commission and the university, and the topics get picked up collaboratively, and the students are able to inform this. We also were fortunate in Kansas because we have our Blue Cross Blue Shields of Kansas funding a project called Pathways to Healthy Kansas, and part of this project is focus on health policies. So that again helps with that synergy and getting that input on that curriculum and those case studies, and actually continue to spread this in Kansas.
Great, thanks for all that. And continuing, I think a theme across all this has been that practical application. It's you can have the lecture, you can learn the theory, but it's through the examples, it's through the hands-on work, it's through some of this simulated work that you're getting an idea of how you're making decisions and moving through this at all these various scales. And so, Anna Marie, the last specific question for you is, what other kind of practical applications have you encountered that you think are worth sharing with folks that would be teaching HIA or HiAP? What are those practical applications that maybe we haven't talked about yet today?
I think I mentioned some of the ones in our earlier response, just looking at different frameworks, having the pre-populated scenarios, incorporating AI. Those are some of the practical aspects. And again, really modifying it, something I hadn't fully understood before I started doing health and all policies work, was how flexible and powerful it truly is, and how it's not only for the consultants or the academics or the nonprofits or professionals, but how it can really inform policy and propose projects and plans across all settings. And if you can have it conceptualized or scoped into work earlier on, the better, because it will really assist in advancing the agenda for incorporating health in the decision-making process. I've seen it more intentionally incorporated now than it was 15 or so years ago, and it's truly making a difference in how projects are being implemented.
Thanks for that. And oh my God, just switch over to 25. So really appreciate you guys on this last panel and then all the panels today. And I feel like we've just touched the surface of all the questions and all the ways we could think about this, and knowing that the people are on here that design these courses and teach these courses and are very open to this collaboration and making it practical, making it useful, building that capacity across the system. And to echo what Flo said earlier, please consider SOPHIA a great resource to connect with folks doing this work and get that firsthand experience. If you're timid and shy about reaching out, please don't be. SOPHIA really is a welcoming organization, and we are all here to help advance the field and solve these issues and explore these topics. So really appreciate the opportunity to spend some time with you all today here, and I'll hand it back to Tatiana to close us out on a great virtual event.
Awesome. Well, thank you, Jimmy. As we wrap up today's event, we really hope you're feeling energized. You got some practical ideas how to bring health knowledge policies in academic spaces. As we heard from our speakers, embedding health knowledge policies isn't just about the content, it's about really giving the tools, the right tools at the right time to the students who are future leaders, and actually have a shared responsibility across the sectors. So when we really bring health knowledge policies into the classroom, it's like we're normalizing the idea that health should be considered in every policy and not just in health policy. It's what I'm energized about, that this is not just it really helps with this systemic change, where the systemic change can begin. We know that a lot of those students are future decision makers, and by introducing those concepts early on can really help them to think critically, act collaboratively, and no matter what their field are. And we heard that from all the speakers, that it's really cross fields and cross disciplines. Thank you again to SOPHIA and to our amazing speakers for joining us today, spending some time sharing their insights. Really appreciate all their collaboration in the chat, answering questions, providing their input as well. And so in being able, offering to staying in touch and providing that support. We would like to flag, we have a survey in the chat. It would really help us to improve future events and also to get some additional feedback from you, or if you have any additional questions, please fill out that. You can scan a QR code as well as follow the link. As Jimmy said, and others, we again want to flag, SOPHIA is a great resource for your team, for your students, for faculty, and for others in your community. Please consider joining SOPHIA. You can see QR code and a link as well. And I also want to note that materials from today's conversation, we're going to have event recap and resources. Some speakers shared with us articles, as well as some other in the chat, will be posted to the KHI webpage and the SOPHIA webpage. And as you register, we'll receive the link that you will be able to access all those resources. Please share it with others in your community. And thanks again. And we're looking forward to you continuing this work and staying in touch with us.